What's up, guys? John here, Titan Talk Tuesday. Thank you guys for joining in. I'll wait while everybody comes in and joins in. We got a lot of stuff we're going to cover this Titan Talk Tuesday. So it's going to be interesting. I'm going to cover a lot of different things. Some myths, facts, therapy of the week, events coming up. I'm going to actually kind of show you what I eat every day too, because I actually had my lunch. It was kind of a late lunch. I went to go train, thank goodness. I got 1 or 2 training sessions in. Well, only 1 so far this week. Hopefully I get my second one tomorrow. What's up? How you guys doing? Thanks, man. Let's take some lessons from you, Dave. I had to do that. 2 days. This is all it is, man. It's pretty thick for 2 days, right? Just shave underneath and over the top. Sharice actually likes me with facial hair, so at that point I told her I would grow off the beard again. I usually have it once or twice a year. I'll throw it on, but I like to shave it off, especially in summer. It gets hot. I don't get sweaty. You know, it just is what it is. But I don't mind the beard. It just is what it is. So, new Titan today. We're going to also cover that. We had a really big signing of another big athlete in my eyes. He already has a pretty good following. He's a part of another big national company too as well. So, big ups to him, and I'll bring his name on very shortly. I just want everybody tuned in so I get everybody. Keep the chops, bro. I appreciate it. Thank you, Pat. I will. So I'm getting a lot of good feedback. So everybody likes a beard like Sharice too, huh? So I guess she's not too far off. Yeah, I guess, you know, without the beard I look a little bit younger, more approachable, I guess. With this, yeah, everybody tells me I look very unapproachable. You look always mean. Yeah, I always get that. So I always, you know, I always like the, you know, the little soft look, I guess, to let everybody approach me. And then if they check the kindness for weakness, I have to give it to them. But that's what it is. So, all right, cool. What up, Terry? How you doing, man? Hello. All right, guys. So let's get into some of the things that we're going to talk about. So let's get into the events, because events are coming up real fast, real quick, and we got a ton of events coming up. So we are right now in March. And March is crazy. You know, it's the 12th of March. We're just gearing up, really. Now, April, I would say that's when a lot of these big events are coming, right? So April 7th, 1st, that is a huge weekend for us, and Titan Classic, PCA, so it's a huge show. On the exact same day, we're doing Festival of the Speed. So we're the title sponsor for the PCA Titan Classic, obviously, and we're the big media sponsor for Festivals of Speed. We're the exclusive HRT company there, part of that, and the Orlando one as well. So I'm really happy to be a part of that with them, sharing that. All the exotics coming out there. It's really cool. It's really cool. So at that point, if you guys are in the area, come out. You can check out the Titan Classic and then come over and check out some really cool exotic cars with me. Take some pictures with the Titanettes. Get some free Titan gear and know what the Titan lifestyle is all about. Because it's not all about the extreme, like, I'm going to train every day, I'm going to watch every calorie that goes in. That's great for somebody who's doing a competition, but the everyday Joe doesn't do that, okay? So enjoy your time off, do it with your family, right? Do things that make you happy, be active, be positive, do things that create a healthy lifestyle, create that environment for yourself. That's the best thing I could say, man, all right? So at that point, hi to March, yes sir. What up? Janine, I will be calling you after this. I did not forget about you. All right, so that's April 7th, so Titan Classic, Festival of Speed, right? I just want to go into to chronological order real quick, if I can. So we have that on April 7th, both those events. The next weekend after that is Orlando, Europa. We have a huge presence at Orlando, Europa. This year I'm bringing a lot of people for Europa. So at that point, it's going to be a dominant thing. So we are bringing out a lot of big things for you guys. A lot of free Titan gear we're going to give away. Free contests for blood work. Free contests for amino acids. Free contests for patients that come out. So come out and join us. That's the next weekend after. So it's April 14th and I believe the 15th, which is a Saturday and Sunday. We'll be out there Friday night, rocking and rolling and setting everything up too as well. So we'll see you out there. If you see us, come take a picture with us, say hello, tag us on social media. Hopefully you guys get shirts, bags, all kinds of things. So follow us on social media. I'll have some contests too. All right? So the next thing after that, I think would be July. And at that point, that's going to be huge. In July, we are the title sponsor for the PCA Miami. July 7th, join us for that one. It's going to be another huge show. So we'll be out there representing down in Miami. Come join us. We'll hit South Beach afterwards, I promise. All right? After that, We have the NPC Seminole Classic. That's 2019. That will be coming up this summer. You guys watch out for that. That's my man Jose Santiago with the Iron Bay Classic as well. So we're title sponsors for both those shows. NPC National Qualifier this year. Big ups to Jose Santiago. Man, a lot of big work. All right, Santran, you guys are doing an awesome job. So let's move on to another huge show. My man, Dennis Warren, Big Deke, my man, dude, title sponsor again for his shows. Now, he did something extra. He was like, John, we're going to do big, right? He said, we're going to bring in Mr. Olympia. I said, awesome. So Sean Roden will be in the house, guest posing with a title sponsor. You guys will see us there, right? And these are a lot of big events. So we have way, way more. You know, on West Coast, hello. All right, we're trying with the West Coast. Hey, boss, I sent title medical. All right, if you sent your paperwork in, did you fax it? Text the line, 727-389-3220. And yesterday I was wondering when you guys get back to me. All right, so text the line, 727-389-3220. Tell them you sent in your new patient paperwork. If you filled it out online or if you sent it in, scan an email, the girls will take care of you, okay? So text that line. Text that line now. All right, and I'll follow up and make sure they follow up with you, okay? So those are the events coming up. So that's June 15th. That's another huge event. So that covers a lot of events. And we got a lot more events coming up. There's so many guys that we're a part of. It's really hard to keep track, to be honest with you. But we're happy to be partners with a lot of these different people. They have the same vision as Titan. They believe in a healthy lifestyle in most cases. They want to do the right thing and be positive. So thank you guys for partnering up with Titan Medical Center. We're very choosy who we partner up with. So it's definitely, you know, it's us vetting and them vetting us and making sure it's going to be a great partnership. So that's awesome. All right, guys, let's cover Therapy of the Week. So Therapy of the Week this week is ECA Stack Plus. Now, you might hear a lot about ECA Stack Plus for our patients, our posts. A lot of people get those results. It's in a capsule form, so it's not an injection, so it's not as intimidating to some people. Some people have no problems with injections. Some people fear them to God. Some people have never done them. It's a fact that 7 out of 10 people that come to Titan Medical Center are regular people and have never done injections. So even a little insulin needle is kind of scary or a little intimidating to the regular person that's never done it. Until they do it the first time where they understand it's not going to hurt them, it's not going to kill them, it's not going to have any harmful effect, and they're going to get a great effect out of it, then they are all on board and they're like, oh man, I want to get some. So at that point, that's what it's really about. So when you're doing these injections, it's key, you know, to really teach somebody. But the ECA Stack Plus, you ain't got to worry about that. It's in a capsule. You're ready to go. So what does it have in it? So it has a real ephedrine HCl. I got asked this by the athlete today. Real ephedrine. So it has aspirin, B12, chromium, and it has caffeine. So ephedrine and caffeine are going to give you the fat burning properties, energy properties. It's going to help you concentrate better. The chromium and B12 are going to help you naturally stimulate your boost your natural metabolism, help you process fats faster in the body, and you're going to have aspirin, which is going to thin the blood a little bit. No heart palpitations, no jitters, no problems. Good natural energy. It's going to fat burn through the day no matter what you're doing, right? And if you're doing the cardio or doing the things you're doing right, like diet, your hormones are on point, you're doing everything right, you will yield the results. Now, this is really, really great. We have some summer packages we're going to release here very shortly in maybe another month or so to help you guys really expedite the results and get to that summer body that you want, or at least as close to it as you can, right? Because we should set goals, and really reasonable goals and obtainable goals. Nothing too low, but nothing just crazy extreme high, right? So let's go on to that. ECA Stack Plus is great for a lot of different things. Capsule form, we have 3 doses. We usually only promote 2. We have a low dose and we have a high dose. At that point, if the high dose is not affecting the person and they're really tolerant to stimulants, we do have an ECA Ultra. That is the little red and white one. But the low dose is pink. You usually get the blue and white one, which is the high dose, and that usually is great for people. And it takes out a lot of different great things that you guys want to cut out of your diet. So if you're taking in a whole bunch of coffee, like 2 pots, I hear from some guy, that's not good. So at that point, he has substituted this and taken away the coffee. Monster, Red Bulls, energy drinks, all that stuff, you have no idea what the other fillers, all of this stuff that's in it. And that could be having a harmful effect on the body. So at that point, you really don't want that. And the cost effectiveness from taking that away to taking 1 or possibly 2 of these a day will do you a lot better for your health, and on your budget. So your pocketbook will help you and thank you. So at that point, ECA Stack Plus, great therapy. All you have to do is fill out the new patient paperwork. You see the medical provider, right? You always want to see the medical provider, not talk to them on the phone for the first time, nothing like that. Making sure they have a DEA license and a medical license, and they are properly trained to treat you in these therapies. So at that point, that's what the ECA Stack Plus needs. So doctor's visit with the medical provider, ARNP, and you need the new patient paperwork. So all you have to do is basically go on the website. You can go on there, fill out the new patient paperwork. We can always send it to you too. So you can always call or text 727-389-3220. For this therapy or any other therapies, you can always call or text us at that number and ask us about it or become a patient. You can also set up blood work with us nationwide. We help you out there in a lot of different tests. We cover a lot of different tests, and I'll talk about some of those different tests too. So a big one that I've been talking about now, DC Baker, I'll grant you some summer packages faster, and you guys will do it. My man Art behind the scenes doing his thing. All right, so one other one. What's up, man? How you doing? All right, let's talk about blood tests. So we talk about free and total testosterone all the time. Free and total testosterone. Males and females both have testosterone. And when you test, you usually test for free and total testosterone. Now, when they put in the blood requisition, they're going to put you in the gender, male or female. The difference is when they put you in for this, your reference ranges, those numbers on the side that come back after your range comes back, they're on the side. They'll tell you if you're normal, below normal, or high. Those are reference ranges. And if you're male or female, that's going to change the number on the side of those reference ranges in some tests. So free and total testosterone, that's going to be one of those tests. And at that point, a total testosterone is going to be like your reservoir. It's going to be everything that you have, right? And your free testosterone is what it's utilizing out of that reservoir in your body for bioavailability, for you utilize it in your body, so you're really feeling the effect of the testosterone that you have. So a lot of people, or some people, have a good amount of total testosterone and a low free testosterone. So at that point, their body's not utilizing the total testosterone that they have, and they have the symptoms of low testosterone. So it's very key to test both total and free, because if you go to your primary care in some instances and you say, I want my testosterone checked, you might not know the back lingo. I need a free and total testosterone, doc, right? You're just worried about getting your testosterone checked. You hear about low T. I want to get my testosterone checked. Primary, check my testosterone. No problem, buddy. He writes a total testosterone. He gets your total testosterone lab back after you waited a week or two and you scheduled your appointment, you paid your copays, you go in there and you sit there and he looks at it and it might be a great total. So he tells you, hey, listen, you're at like, let's say a 700, between 216 and 946. You're a pretty good range and you're 50 years old. So, hey, you don't need testosterone. Maybe there's something else going on. And then you start looking at all these other things that could possibly going around with you on Dr. Google and WebMD and all this great stuff. And you start really just banging yourself into thinking that something's wrong, when it could be just free testosterone. So at that point, I will talk about BPC 157 in 1 second. So at that point, you really gotta, test for the right things, and the people that are testing you for these things, these medical providers, if they're in tune to what's going on and they really practice this day by day, and this is what they do as their profession per se, because doctors can do a whole bunch of different things. They can be, this hat at the hospital and this hat here at primary, and then he's doing this for hormones on the side. But if they're doing this and that's all they're focused in on it, it's more of a routine. They're doing it every day and they really know what to look for. They come across these issues a lot more. So in effect, they're a lot more trained. They have a lot more experience in some of these different areas. So at that point, when they test for the free and total, if they do test the free and it's low and their total is good, there are ways to bring the free up. We do have therapies that will bring the free testosterone up. One guy asked me today, because he did have a low free, he said, I heard like Anavar is going to raise it up, Oxandrolone. It's probably, come on. There's different things that can help a lot better ways than taking these other things. So at that point, watch out, test for free and total. If you're not getting your blood tested for these hormones from your general primary or your OBGYN, because they're telling you that these hormones can fluctuate every day, listen, get these things tested. If not through Titan, somebody. But I guarantee you that Titan can help you out nationwide, and we usually have the best prices around in the country. So at that point, I want to make sure. All right, let's talk about BPC 157. So, BPC 157, body protecting compound. That's what it stands for. At that point, the body protecting compound, BPC 157, it's awesome. It's a mimic of like the gastro juices in your body. That's where it comes from at that point. At that point, what is supposed to be done is, and I've seen it in oral form, and some people usually help with oral form, it's supposed to like ulcers, stomach problems, gastro problems. It's really, really good for those areas, and that's really what it was, in clinical trials for the things. So at that point, if you do inject it, you really want to inject it site-driven. So closest to the area that you really have the injury at. Now, if people have knee injuries, don't inject it in the joints of your knee, guys. Do not get crazy. I know people that have done this, and it doesn't feel good, and you might hit something you're not supposed to. You're not trained in this, and either am I. So I'm not going to tell you to do it. But subcutaneously, closest to the area. So most problems, like myself, BPC 157, I had like a shoulder injury. So what you want to do is sub-Q. You can go at an angle. You can do that. And you usually will be to the effect of getting really, really great results. And it's not the miracle cure. It's not going to cure everything. It's called the healing peptide, but it's not going to heal everything. One guy said, I have a dislocated shoulder. Is going to put my shoulder back in place? No. It's good for wound healing. It's good, like I said, for ulcers. It's good for like shoulder injuries, joint injuries, and stuff like that, with helping the blood go to that area. All right, and really, really trying to help heal that area like that. So that's BPC 157. We do offer that, and we do offer TB 500, which is thymosin beta 4. All right, and those two synergistically, and that one works throughout the body wherever you inject. So you can inject subcutaneously in the stomach area, and it still works systematically throughout the body. So taking those two together synergistically should get you optimal effects. Now, I do want to talk about a new one since we're on the peptide thing. Now, thymosin alpha 1 is a new therapy that Titan Medical Center is offering. What is it? It is an immune modulator. It's going to help boost the immune system by raising and producing more T cells in the body. At that point, it's going to help in a lot of different ways. What was it approved for as an orphan drug by the FDA? At that point, it was for melanoma in stages, I believe, 2 and 6, and that should tell you something. It is not even talked about. Why? At this point, we know it's a peptide. It has a very, very safe profile for patients. Our doctors, we know they are very happy with some of the results of some of the patients beginning. So, thymosin alpha 1, immune system modulator, I will talk more about it. I just wanted to tease on it for you guys. But we do offer it, so you can call Titan and talk about it, and we can help you out with that. So, you've heard about some of these peptides. The healing peptides, BPC 157, TB 500, right? Thymosin alpha 1, which we'll call TA1. So, it's very, very short, so you guys know. TA1, thymosin alpha 1. Guys, check it out. If you don't know, now you do, right? All right, so what do we got up here? What up, Louie? Hi, Stacy. Neil, what up, dude? Shane, my man. Do you do MK677? So we do MK677. Might as well talk about that too. So a lot of people thought that MK677 was a SARM. SARM is Select Androgen Receptor Modulator. It is not a SARM. It is a GHRH. It's an oral GHRH, the only one that we know in clinical trials that worked. Oral GHRH, growth hormone releasing hormone. What it's going to do is it's going to help you stimulate your natural pituitary gland to produce your own growth hormone, which in turn should go down and convert in the liver to IGF-1 and give you all the benefits which IGF-1 gives you. And these studies were done at 55 and older, so it's really, really good. And people that have low IGF-1 levels, usually they might be tired, skin elasticity might be bad, there might be some other issues. So at that point, raising IGF-1 levels with somebody that needs it is very beneficial. Really, really overstimulating it per se might give you some fat loss and anti-aging effects, but having a good number at the higher level would be good, right? Going over and finding crazy numbers, and I've seen crazy numbers, could mean a lot of different things, like a tumor on the pituitary, and it could be overstimulating, right? And this has happened quite a few times. So be conscious, right? You want great effects, don't overdo it. You don't have to overdo it. Quality over quantity every time, I promise you. What is good for your brain? All right, which one we got here? And I'll answer what's good for your brain. So MK677 oral GHRH. You can take it, fill out the new patient paperwork, medical provider. You will be able to do MK677. I appreciate it. Thanks, Matt. This is actually an old one. I brought this one out. I think this one was last year. We did these Nike jerseys. I had them in my closet, and I'm like, you know what, man? I ain't got to wear this in a long time. I love some of my gear. I've got Titan gear from when we first opened in 2012, and I won't throw the shirts away just because one day I'm nostalgically gonna look back at it and be like, damn, I can't believe I even let this out like this, right? No, they were good, but you know, it's like some screen printing on there. It just to this effect. We keep progressing what we're doing. It keeps looking better and better. I mean, even the production, we're going to give it up. Art's been making it look a lot nicer. And if you guys have not been onto our newsletter yet, check it out. There's great polls on there. There's going to be some basically some contests coming up on there too. So you guys are going to want to be a part of that newsletter. Thank you, brother. Going to use BPC and TB post. Yeah, so it would be good for post surgeries especially. It's been really good. We actually have some orthopedic surgeons that actually use BPC 157 and TB 500. They've used it on themselves because they didn't want surgery and they want to give some effect. Now, another good one for anti-inflammation, and inflammation causes a lot of problems in the body, is glutathione. It's a super antioxidant. It's going to help with anti-inflammation in the body. Plus, we know it's a super antioxidant, right? It's one of the best antioxidants out there. They call it the mother of antioxidants. It's going to help in a lot of different ways as far as detoxing the body naturally without you having to go to the bathroom a million times or feel like garbage. It should actually make you feel better as far as mood-wise. It's good for the body in a lot of different ways, but this is a good one. So if you have a high ALT or AST, and we know liver enzymes can get high in people from a lot of different ways, from fatty foods, so they'll have a fatty liver, or supplementation or something they're taking in, because we know the liver's processing all those things through it. At that point, when the liver does go high, and athletes, if they're training really, really hard, at that point, that can cause liver enzymes to be high too. So you got to take that in effect. That's another thing that primaries do not take into effect, primary care physicians or your regular doctor, general practitioner. It's somebody that knows athletes or regular people that are training possibly or working out real hard that these liver enzymes can be high. So they got to know how to treat it and they got to know what to look for. That's why blood testing is key, because you can't look on the outside of somebody unless they're turning yellow. And we have had patients start turning yellow from jaundice because their liver functions were getting that high. And at that point, we helped them, got them glutathione, and their liver functions went back down, and they stopped looking yellow. Do not look like an alien. Do not look yellow. You don't want that. It's not a good look, dude. I promise you. All right, so what is good for your brain? All right, Warren Limwell. So this is a good one. So there's a lot of different, there's two different things I would recommend as far as that goes. The first one and the best one that we have naturally is the Titan Ultra. Titan Ultra has NADH in it, and NADH is the big one in this. If you have not heard of NADH, look into it. So they use this for Alzheimer's and dementia patients. It's great for memory function, cognitive enhancement. This is what is great. So it's in every living cell of the body. As far as energy moving in, cell to cell. It's great as far as that goes. So look into it. But that's only one component. You have carnosine in there, you have taurine in there, and you have B12 in there. So we know it's going to help with energy, nervous system, brain function, and like I said, you're going to get all these components together in one injection. So that would be the first one I would recommend, and that's the one I take every day. I think that one really, really helps me out with mental fatigue per se, because it can get draining. There's a lot of things that are going on here, even when I leave here, as far as the business goes, family goes, a lot of moving parts, and you got to be on top of it, because if we're not on top of it, it's going to crumble. So you got to be on top of it, and that's one I do recommend. Now, along with the ECA Stack Plus, because the ECA Stack Plus is going to give you energy, and it's going to let the brain really, really focus in on a lot of things. It doesn't produce too much of a speediness in your mind where you really can't think about things. So at that point, you guys will probably benefit from those two together. As far as weight loss goes too, so it'll have a lot of different great functions that you guys will benefit from. All right? What do we got here? IGF-1. Oh, I knew I was going to get that one. All right, so IGF-1. we do offer IGF-1LR3. You will need a blood test for the IGF-1LR3. But at that point, it's really, really great. IGF-1 and IGF-1LR3. IGF-1 is short acting. It stays in the body a very, very short amount of time. IGF-1LR3 stays in the body a long amount of time. So at that point, a longer half-life in the body should give you way more optimal effects from that medication as far as that goes. Now, I just heard that we're offering, and this is an awesome mix, and this is from the U.S. pharmacy, U.S. compounding pharmacy. We don't make any medications. We don't hold any medications. None of your medications will say Titan Medical Center on them, and they shouldn't say any other clinics on them. So if you're getting a medication that says your name on the bottle, like that's not right. Or their name on vials, that's not right. So watch out for that. Anyway, this mix is awesome. IGF-1LR3, CJC 1295, and iPirona. So at that point, you're getting IGF-1LR3, you're getting a GHRH, and almost like a GHRP. So you're getting like the best possible combination you can possibly get. And I think it's the exact same price of our IGF-1LR3. I think we're doing the new upcoming like special for it. I don't even know if I was supposed to talk about it, but it's coming. You guys can talk about it now. I've let the cat out of the bag. I hope you guys like that one. I've heard a lot of great things about it, to be honest with you. We've had some patients, and we usually have some patients that, get to try some of the therapies out. They've been with us over 6 years. They know kind of what the therapies are. They're not afraid of injections, so that's what's up. It's really, really cool. Vintage Titan gear. Yes, Jay Jacobs. Yes, sir. That's what it is. All right, guys. So I want to show you guys what I eat every day, because this is kind of crazy. I get a lot of questions about it. I don't know what we're doing here. All right, so every day, all right, first I eat the steaks. I eat steaks, 2 8 ounces in the morning, and the potatoes, done. Lunchtime, though, this is what I eat every lunch. So we've got some grilled citrus chicken in here and some almond chicken, baked chicken. It's really, really good. Yeah, almond and baked chicken, really, really good stuff. This is exactly what I eat every day. Done. So you guys know. And that's it. I don't eat anything else. Nothing crazy. Maybe a protein shake after workout if we're working out real hard or beforehand, depending on how hungry I am. All right, so new upcoming Titan video. I want to talk about that. So I made a video today, a very serious video. I wasn't in a jersey or anything like that. I made sure I dressed up because I wanted you guys to take it serious, because I take it very serious. Now, HRT clinics out there. There's a lot of HRT clinics out there. Titan's not the only one. We know that, right? We do think we're one of the best ones out there. I think our service is untouchable. I think I know some of our therapies are niche, and they're not going to be able to get those. But there are some other good ones out there. I won't knock anybody. I definitely would not do that, and I respect some of the people who are in this, service and medical field before me. They've done some great things, so I have to give it to them. Now, there are some bad ones out there, and there are some red flags that you're going to want to look for. And the average everyday person doesn't look for these things. And you shouldn't have to, right? It should be blind faith. If they say they're a medical center and they have a doctor, then you should be able to walk in there and think that you're going to get that. And you're going to get real medication because it's prescribed, per se. Now, we've come across a good amount of people that have been getting fake medication from an HRT clinic. And at that point, we have some documentation that's pretty scary. So I want you guys to just know what to look for. So when you get a bottle from a U.S. licensed pharmacy, and here's one from TaylorMade, really good. And at that point, it's going to say your name. It's going to say the pharmacy, and it's going to have their address on it with your name, RX number, the prescribing doctor, what the medication is with directions on the outside, their number to get a hold of them, when it was filled, everything like that. Okay. And then we pull it out, and this is the fresh one, right? It's going to be sealed, and it's going to have the name of the pharmacy on it. Not my name. Can't be a medical center. All right? This is from a 503A pharmacy. And in the video, I'll explain what a 503A pharmacy is. And it has all this. And I'll explain what to look for in a lot of these bottles. And there's a 503B pharmacy where it says not for resale. And so if somebody's selling you a vial like this and it says not for resale, it's not for resale from the medical center to sell to you. Not for you to resell to somebody else. So you shouldn't be having that bottle in your hands. Here's one with capsules, Like I said, the pharmacy should be on there. Your name, date of birth, phone number, date filled, RX number. Now here's the big trick. Even if it says this, because anybody can print a label, right, and slap it on there. The big thing is you should be able to call that pharmacy with that number and verify that you got that prescription filled through them. They'll tell you. You're in their system, and then they'll tell you if you're not. And if you're not, and let's say it's per se testosterone, which is a controlled substance, at that point you're walking around with an illegal substance that can give you a felony. So I would really, really watch out and really, really make sure what you have in your hands is real, because if not, it could possibly get you in trouble. And your deniability at that point could possibly get you off. But why would you want to be in that situation to begin with when you're paying for the medication? You think you're getting what you're supposed to be getting, but you're really not. So if you're not getting this, watch out. So watch out for this video, because I give a lot of red flags, what to look for, what to ask, who you should be seeing, looking for their medical license, a lot of different things, right? So stay tuned to that video. You guys are going to love it. All right. So I told you guys I signed another big athlete today. In my eyes. You know, I think he's big. He is big. It's Big Dru, right? Big Dru. So Big Dru is coming on board as a Titan medical athlete. Really, really impressed with Big Dru. We've had a lot of conversations over the years, and we finally got to, you know, come together, seal the deal per se. We see, you know, eye to eye on a lot of different things, man. We've been in this business, him especially now, fitness for a long time. He's a 5%er. He was rich. So he knows the business per se, and he knows what it takes, and he wants to be healthy. So at that point, that's why he wanted to come to the best. He wanted to come to Titan Medical Center. He wanted to get his health under control and make sure that he's healthy, because he's doing a lot of traveling. He's getting bigger in what he's doing. So at that point, he wants to feel his best. He wants to look his best and make sure he's on the up and up. So Titan Medical Center was happy to have him. Now, I mean, I pretty much got, I mean, I won't say they're my Avengers, because I know there's an Avenger squad out there, whatever it is, or Justice League and stuff like that, but they're like my Titan monsters, man. They're those mythology-like creatures. Jeez, oh please. Mythology-like creatures that you see in mythical creatures that you only read about in books. Thank you, Art. All right, so these mythical creatures, man. I mean, Big Dru, Rodney Fillon, Jeff Kalb. I mean, those three guys are just monsters. So at that point, they make me feel really, really small and tiny. And the veins on some of these guys are just ridiculous. The weight they can push, it's just uncontrollable. It's crazy. So I respect them. Now, does every guy want to look like those guys? Probably not. You know, but you know, there are guys that want to look like that. When I was a kid, I looked at superhero figures and stuff like that, and I wanted to be that guy. I want to be strong. I want to protect. You know, that alpha male. You know, that thing that's, you know, kind of, I don't know. People really don't like alpha male these days. Some do, some don't. You know, and that's everybody's opinion. But I do think this, and I know this for a fact, that all the blood tests we do, I would say about 7 out of 10, maybe 8 out of 10 people come back lower deficient for testosterone, whether it's male or female. So does that have or play a part in the role in what's going on? But it could, right? We know that. Those bottles don't even look like right people. Please be careful. Titans all, yes. So Matt Wolf knows. He's living proof. Yeah, he knows. So at that point, we have a lot of people out there. So guys, be careful. And the reason I say this is be careful because if you're not careful, you're injecting this in your body. Those pharmacies that are U.S. licensed, they have to go under testing for all these medications. And they have to run these tests and make sure by a third party that they're okay. If you're getting this from somebody else and you find out it's fake, there were no tests ran. Where was it made? It's scary, guys. And you're injecting that in your body. You have no idea. And it might not cause you harmful effects today, but later on down the line, it possibly could. So keep that and be aware and be smart. Is a couple dollars really worth your health? That's your choice you got to make. All right, so we covered that. Big Dru, do you need blood work for Hercules Potion? All right, guys, so let's talk about this. You do not need blood work for any of the amino acids. So Titan Complete, Hercules Potion, Titan Ultra, Titan Serenity, which is great for sleep, anti-anxiety. Tighten Up, Super Titan, all those, you're good to go. ECA Stack Plus, no blood work. All you guys have to do is you're going to fill out the new patient paperwork. You're going to meet with the medical provider. You're actually going to see them. You're going to know who they are. So if you were in a crowd, you'd be able to pick them out and say, hey, that's my medical provider right there. That's the person that prescribes you medication. And you have a great relationship with them, right? you'll know who they are, and not to say, this guy called me on the phone, and yeah, he said I should take this, this, and this. Who are you talking to? I don't know. Kind of scary, right? That's kind of scary, guys. You guys might as well talk to your local drug dealer. I mean, seriously, it's the exact same thing. You know, I mean, just because they're out in the open doesn't mean they aren't doing shady stuff. There's a lot of different things that happen over the past couple of years that we know. So, Hercules Potion, no blood work needed. You do not need that. Jack Cookie Monster. What's up, bro? What's your best therapy for fat loss? So, Scotty, the best fat loss per se, and I did cover this, ECA Stack Plus is our therapy of the week. You know, price-wise, you know, it's very economical, I think, and at that point, I think it's going to give you the best results with that. Now, can you mix together some different things, like Titan Complete with the ECA Stack Plus and the fat-burning cream, so you're getting injectable, you're getting the oral version, and you're attacking it with topical, you'll probably get the best results there. Always check the hormones. Make sure that they're optimal, healthy levels. That way you know everything on the inside is running correctly, and now you just got to tweak it and dial it in. Dial in the diet, make sure you're getting the sleep, make sure you're getting the activity, the proper activity and training that you need, and make sure that you're taking the therapies. At that point, if you're very consistent, I promise you will get results. If not, there's some underlying problem. There's something that you're not telling or doing or what's going on. So at that point, be honest with yourselves. Do not cheat yourselves. If you tell somebody you didn't per se eat something and you really did, you're cheating yourself and you know it, well, than anybody. I'm not saying people do that, but there are some people that do, right? So just be conscious because you don't want to cheat yourself. All right, so that was a good one. All right, if I'm in North Cal, they'll do it. No, so we service nationwide. So guys, if you guys are out of state, we service nationwide. If you can't fly in, we do a video conference. So you'll meet with the medical provider. You'll see them, they'll see you, you'll hear them, they'll hear you. And you'll go over all your questions, concerns, new patient paperwork. They typically last 30 to 45 minutes. All right, so at that point, you will get to see the medical provider. You'll get to ask them all the questions, go over the therapies, maybe have questions about another therapy we have. Maybe they have another recommendation of something that might help you or benefit you more because of what they read in the new patient paperwork that maybe you weren't thinking about. That's what we're here for. That's what the medical providers are there for. They're there to answer your questions, not me. So you'll never hear me get on the phone and recommend you a medication. Oh, you should go on testosterone or thyroid medication. Guys, I see a lot of people, our doctors are getting scared because all the thyroid medication is getting prescribed. Thyroid's crazy. Testosterone low, you mess that up. You know, like younger guys, they take anabolic, black market testosterone, and they shut off their function, and they're done at that point, and they can't get their natural levels back up and have to go on testosterone. You know, the thyroid is a lot scarier. And at that point, so if you mess that thyroid up, you're going to mess a lot of different things up in the body, and you're going to have a lot of problems for the rest of your life. And it's worse than low testosterone symptoms. I promise you. So definitely, if it's thyroid medication, you should at least blood test twice and make sure that thyroid is properly right and there wasn't a skew on the blood test, and make sure that you're diagnosing it or the proper medical professional is diagnosing it properly for you. So be careful about that thyroid medication. And 22-year-olds, and there's always that circumstance. There's always that only one circumstance or very minimal circumstance that people may need testosterone at 22 years old. But 22-year-old people don't usually need anabolic testosterone, androgen testosterone, injectable testosterone to get their levels back up. Usually they're in a good range. So watch out. Because you got to live in your body for the rest of your life, nobody else. So I'm moving to South Carolina, so Florida is only going to be 7.4 hours away. So all you have to do is video conference. So you can be on your cell phone, you can be on a tablet, you can be on a computer, you're going to video conference with a medical provider, you don't have to fly in. It's going to be very simple, very easy. You can do it in your car. So if you're driving right there, you can take a break on the rest stop, do a 30 to 45 minute consultation, sleep for 30 minutes, get back on the road and rock and roll. And a safe drive for you. If you had the ECAs, you would be going all night probably. Those things definitely keep me up, definitely keep me rock and rolling. Now, the best thing about them is if you take them in the morning or afternoon, they don't keep you up at night. If you take them real late, yeah, of course, they're going to keep you up. You're taking a stimulant. But if you're smart about it, you're not going to have that problem. Emilio, a.k.a. our mighty Titan Duck, yes. So Emilio, Dr. Perez, we love Dr. Perez. He's one of our doctors here. We have a couple other doctors on staff as well, and we're expanding out. So we are franchising, corporate stores, stuff like that, working on all the deals. Do you have something to replace thyroid meds? So thyroid meds, it's really, really, like I said, it's a sensitive subject when you start talking about thyroid. So if you're on thyroid medication right now, what kind of thyroid medication? Because most of the doctors, primary cares, you're on levothyroxine, you're on a synthetic, thyroid medication. Now there's like Armour Thyroid and stuff like that. Doctors prescribe. That's more of a natural thyroid medication. That might be something, but you're going to have to check with your physician, or you can actually make an appointment with our physician, and they can kind of give you the advice that you need there. I'm not a doctor. I don't claim to be a doctor, and I will never tell you what's right or what's wrong. I'm just telling you what I've done, kind of give you information about the therapies, and try to help you out with some information. So yeah, I think that's really, really about it. I mean, definitely went over my 30 minutes. I had a lot of stuff to talk to you guys about. So big ups to Big Dru today. John Price has been training like crazy. Titan Medical has been at Water every Sunday. If you're here in the Tampa Bay area, come out, say hi, hang out with us. We're real people. We never claim to be this perfect person that only does perfect things, okay? We like to be a regular person that goes out, enjoys the company of everybody else, right? You can have a drink once in a while. That's being an adult. You're being an adult. You're being social. Now, if you have a competition, you got to be strict. I ain't got no competition. I got kids, right? I work 24/7. If I want to go out and have a nice Sunday or a nice night with my wife, I'm not going to get any flack about it. I don't care what you say. I promise you that. And you will be I'm healthy as hell. What are you guys talking about here? Some of you guys that make some of these comments, it's hilarious. I'm like, if you guys are better than me, then you guys can start talking. If you don't, you better get back on your own program and start criticizing me. But I take the criticism, and I try to roll with the feedback. So at that point, make sure that you're in check with yourself before you start throwing rocks at somebody else's house. Levothyroxine. So yeah, I would definitely check about Armour Thyroid. Now most of those primary cares are not going to want you to go on that. So you're going to have to check into that. Thyroid is crazy, guys. Like I said, it's very, very sensitive and very serious. So if anybody wants to put you on T3 for you to lose weight, watch out. That is a red flag. I mean, that's like that's like a bodybuilder type thing, right? This is a medical type thing. That's a whole different ball game. You see some of these guys, and it gives, it gave testosterone like that stereotypical bodybuilder, and that's what everybody was scared of. When I got in the business almost 7 years ago, like testosterone, that was a taboo almost. Like, you don't talk about that. Now it's very, very more socially accepted. People are becoming more aware about our hormones and the way they're feeling, because everybody wants to feel good. Everybody wants a better quality life, right? Nobody wants to feel like garbage. Everybody wants to please their partner or their significant other, or whoever it is. It's just, and they want to feel good. Depression is on a rise. If you've noticed, all the depression medications that come out, now they have depression medications, and they have amplifiers for depression medications. So you take the depression medication, all right, and it's the strongest one, and that's not working. So now they have an amplifier that you take, right, to take on top of the depression medication to make that zoom up. It is nuts. Guys, don't do that, and that has a lot of negative side effects on you too. Now, I'm not saying people aren't depressed, and there are some people that have serious depression that might need medication. But a lot of the different times, these primary cares are not even checking hormones. If they did, most of the time, I would say a good 25%, let's be conservative, they're going to find low testosterone in these people. If they corrected that problem, they would probably correct the depression problem, the ED issue, and all the fat loss issues these people are getting from fat deposits, because their body is just in array on the inside, and it's not working at optimal levels. So just be aware, be conscious. If you don't feel good, you know your body better than anybody else. Tell somebody that wants to listen. Let them help you, but make sure they are of medical credentials and they're in good standing. That's the biggest thing, guys, because if they're not, they really don't care about you. You want to find somebody that does. Titan Medical Center cares about every patient like family. I guarantee it. You can call here and talk to me or Sharice most of the time. Any point you guys ever want to call or text, email, you guys can always call or text, email Titan Medical Center. Please check out our website, titanmedicalcenter.com. Our phone number to call or text is 727-389-3220. Please keep it locked to Facebook, Instagram, YouTube. Go there and subscribe. Man, these videos are getting crazy on there. all Sharice's soapboxes on there too. We don't put it on the Titan Medical Center Facebook page and stuff like that because it's a little bit more personal. And I want to make sure we kind of separate it. So at that point, you guys can go there. You guys can get a really good laugh. She's pretty entertaining, guys. All right? She really tells it like it is. She's even more than me, so I got to respect her for that. That's why I married her, right? Because when I met her, she wasn't this BSer. She didn't sugarcoat things. She wasn't playing games. She was like, so I like that. I can respect that. Please, you know, if you agree with me or disagree with me, at least I can respect that you came at me and told me instead of running around and talking all this other junk. So please, guys, thank you guys for supporting me on Titan Talk Tuesday, every Tuesday. I mean, the show's been going over a year and a half, 2 years, getting pretty close. So I appreciate it's getting more and more traction, momentum. Thank you. I'll see you guys Titan Talk Tuesday next Tuesday as well. And I'll probably do a live here or there. So, you know, just stay tuned. We'll have more content coming at you. If you guys want us to talk about, because I did get this today. I shared Jeff Culp's slow motion picture today. And it's just crazy because he looked freakish. It looks unreal. It looks like a movie, dude. And I respect that because I know how hard Jeff Culp puts in. He works every day, busts his butt. He don't care, sick, hurt. He's there. He shows up. He does what he needs to do, and he's just laser focused. So I can respect that. This dedication. He's got a family, the whole nine. So at that point, big ups to him. But we do share content, like educational content, like injections, our therapies. So if there's something that you guys want to see in particular, please DM us. Let us know on here. Chime in, right? So then we can share it with you guys, and we know what you guys want. We just want to share with you guys the information. We appreciate it. I'm John from Titan, and I am out.